Hi, I'm Whitney Stewart, children's book writer and co-author with my geneticist husband of Genomics, A Revolution in Health and Disease Discovery. We wrote this book for young adults, or really anyone interested in genetics and genomics, and it's based on patient cases. I have no background in science and medicine, but after living with my geneticist husband for 30 plus years, I became interested in writing a book about how human genetics affects health and disease. My personal interest in genetic testing came about with my own medical condition. I was ill for a very long time and nobody knew what was wrong with me. So finally I was diagnosed with a primary immune disorder. And I wondered, perhaps because I'm married to a geneticist, I wondered if there was a genetic cause. Also, I have many family members with complex diseases, chemical dependency, bipolar disorder, heart disease, and autoimmune disorders. You can see this family tree that my mother made, and there are 15 members of my family going back to my great-great-grandparents on my mother's side and her father's side. And they have chemical dependency, and many of them also have a mental illness. So I believe that genetics probably played a role in my family illnesses. I'm not chemically dependent, but still I wondered, would I inherit any of these? Were they all affected because of a genetic cause? I wasn't sure. My husband sees patients with rare inherited diseases, and in 2007 he was concerned about 23andMe that was offering direct-to-consumer genetic testing for health. He had many questions. First of all, was the testing medical grade and accurate? Did they test for all mutations associated with disease, like breast cancer, for example? Would customers understand without consultation with a genetic counselor or a doctor? Would they understand their results? And if they didn't, could their information cause them distress? And actually, another big question is, were these results useful if the samples were coming from a narrow test group, people mostly of European background? In the end, I finally decided to order the test to see for myself. And then when we started writing the book, I decided to order more tests, including whole exome tests and whole genome tests. And then finally, I thought, I should be part of clinical research, actual research that's being done in a medical setting. So I joined Genes for Good out of the University of Michigan for their genetic protocol. And then I heard about All of Us research program. And it was the only one of these that was done in a clinical setting with medical staff members that you can ask questions of. And I was really eager to join that one. Here's an example of my health results from 23andMe, the ones that they highlighted. I was interested in the coronary artery disease and atrial fibrillation. My father died of a heart arrhythmia, and my mother has coronary artery disease and had a heart attack. And 3 of my 4 brothers have atrial fibrillation. But I didn't know what to do with this information. In the end, I called a doctor just to make sure my own heart was healthy. This is a whole genome test with many variants associated with heavy alcohol use. This was a whole genome test that I took, and this company put me in an 86th percentile for heavy alcohol use. And it said that I had many variants associated with it. As I said before, I have never drank heavily. I was not alcoholic, but my family members were. So it was interesting to me that there were positive results, but without an associated disease. So I wondered how useful this was for a layperson. This is another result from the same company that put me in the 98th percentile of users for a genetic predisposition for psychotic experiences. Now, I have never had a psychotic experience, but some of my family members have. But some customers, if they didn't have a geneticist at home to consult, they might be very nervous about getting a result that said you're in the 98th percentile for genetic predisposition to psychosis. So I thought about this and thought, how useful is this information, and is it dangerous to receive without being able to consult with someone? 2 years later, I looked at my same results from that company, and now they've put me in the 0th percentile. So what does that mean? I did not give another sample. Was it that they have a greater sample size, that more customers gave their DNA? Or were they relying on new science that changed the reporting? I don't know. And I'd have to call that company to find out what's the difference between 2 years ago I was in the 98th percentile and now I'm in the 0 percentile. It's very interesting, but I have no answers. Let's look at the discrepancies between these companies' reporting. So if you could look at this chart that I made up, on the left-hand side, it shows that these are mutations that I have inherited, according to the tests that I've taken, that I've inherited that are associated with a very rare inherited disease. Some of those diseases, my husband has patients with some of those diseases, so I could ask him about them. If you look across, let's look at the top line for the Smith-Lemli-Opitz disease or disorder, and you'll see that mutation. Each one of those companies reported that, yes, in fact, I have inherited one copy of that mutation. As you go down the list, however, there's a discrepancy in reporting. Some companies say that I have, if you look at the next one, the PMM2 mutation. One company, a whole exome testing, said that I actually have that mutation, and 2 other companies did not report it. So what do you do with this information? In my mind, this is very misleading because it could tell me that I have a copy of a mutation that I don't have, or conversely, that I don't have a copy of a mutation that in fact I do have. So for me, I'm worried about this kind of information. Now, there was one funny result that we got, and my son also took a 23andMe test, and so I finally talked my husband into it just for research purposes. And we were looking at my son's genetic cousins, and it says whether, 23andMe says whether it's on your mother's side or on your father's side. And then all of a sudden I see one person, SR, who's related on both sides. And I thought to myself, does that mean what I think it means? So I called 23andMe and said, does this mean that my husband and I are related? And they hemmed and hawed and checked with the experts and came back on the line and told me, yes, you're not very related, not closely related in the recent history, but far enough back you're related. My husband doesn't believe this, but I think it's kind of funny. So in summary, I spent about 15 years doing this research for myself as a layperson. Remember, that's important. I did this as a layperson, but I also had a geneticist at home to consult. You can see that I have 25 file folders of research, and I have no genetic answers for my own medical conditions from direct-to-consumer genetic testing. All of my health diagnoses were made with my doctors through medical testing in a medical setting. So the takeaway for me is that, in my opinion, direct-to-consumer genetic testing is not currently reliable for personalized medicine. And I've put this information in our book so that if customers are actually looking for their own medical results without going to see a doctor, they may be warned. All of Us research program is different, however. It's science being done in a medical setting. The participant does not pay for testing. They're reaching out into diverse communities so that really all of us can be included in future medical advances. I hope this has been interesting, and thank you for listening.